to everyone for our Wakefield Measles Q&A sessions to our health message champions for the district. And just to let everyone know that we are recording the meeting today and it will be shared on social media. And if you don't wish to be recorded, please keep your video turned off and your device on mute, or you're free to leave the meeting as well. Please feel free to ask any questions in the chat box throughout the duration of the meeting, and we'll take those questions at the end of the session. So I'm just going to pass over now to Steve Turnbull, our Director of Public Health within Wakefield Council, and he's going to take us through this session today. Thank you.
Okay, thanks, Emma. Sorry, I was just on a phone call just then, so I missed Deborah arriving. So, but yeah, let's skip on to the main body of the slides. Then we'll go through those. Can you move to the next slide? So,
Yes,
yeah, there you go. Yeah, okay. So main headlines. I mean, obviously there's quite a bit of text there, but I'll just talk through some of the key points. So measles is a viral illness, and it can be serious on occasions. It is the main thing to remember about measles is it's vaccine preventable. So the vaccine works really well to prevent measles. But at the minute, we've seen more cases than normal across the country. And so because we're in Wakefield, we want to protect everybody in Wakefield from all infectious diseases. But obviously, currently, we're just looking at measles on this. We are aware of outbreaks of measles in London, and then more recently in the West Midlands, some quite sizable outbreaks, and measles moves very fast. You might have seen that in the news. What we do see, we saw this with other infectious diseases, is that it does tend to move across the country. We'll see outbreaks in certain places, and nowhere is entirely protected from measles. So we will inevitably see more cases in other parts of England, and obviously local to us in West Yorkshire and Wakefield. So measles does spread very easily if you're not vaccinated or if you've not had measles in the past. So, certainly when you've got in close contact, it can move very, very fast indeed. So nurseries and schools in particular. So just to give an example of how fast it can move, so you might remember well, obviously we all remember COVID. COVID, when it first arrived, would roughly infect one case would roughly infect another 3 cases. Measles is more like 15. So if nobody was vaccinated and this was a new disease, one case would pass it on to about 15 people. So it moves very, very fast through a population. And if you've got something like a nursery or a school, then it will spread very quickly amongst the school children and the staff. The good news, of course, is just to keep repeating this. The vaccine is very good at preventing measles illness. And if you've had measles in the past, and certainly before we started rolling out the vaccine, which was back in the late 1960s, then you may have had measles as a child. Then that gives you lifelong immunity from measles as well. So, but it can be unpleasant, and a certain number of people who've got measles will end up having to have a stay in hospital. And just the last point on there, the 2 doses of the measles, mumps, and rubella vaccine is the best way to prevent it. So, if we move to the next slide, please, Emma. So, what we are very aware of it is that you get your doses in childhood, and if you've got your red book, you can see a little picture of the red book on the slide there. That's where your vaccines are recorded. So you can check in your red book if you've got access to that as a parent or a guardian. You can see whether your child is fully up to date with their vaccines. If they are, that's great. If you don't have the red book, then you can contact your GP practice and they will be able to check their records. And if they're up to date, then that's you've done everything you can do to prevent your child having measles. The first MMR dose is normally given at around 1 year old, 12 months, and the second around 3 years and 4 months. But the important message is it's never too late. So you can always, whether you've had one dose or no doses, you can always have the vaccine. It's entirely free on the NHS, whatever your age, whether you're a child or an adult. You can contact your GP, book an appointment, and they will be able to give you your MMR. If you're entirely unclear whether you've had any vaccine, then there is no problem in just starting again. You can't over-vaccinate with MMR, so you'll be able to have reassurance that you are fully protected. Both doses give you lifelong protection, but one dose gives you some protection, but not really enough. So that's why we need both doses. If you move to the next slide, please. So where it can be confusing is because we have this two-dose system of the MMR vaccine in this country. And as I said, at 1 year old and at 3 years and 4 months. If you've come from another country or you don't have that record, then as I've said, discuss that with your GP and they will put you on the right schedule to make sure that you are fully protected or your children are fully protected. The vaccine works really well, particularly for measles. Having 2 doses of the MMR vaccine will give you over 99% protection. So it works really well. Mumps, one other part of the vaccine, it doesn't work as well, but it does reduce the severity of disease. But measles really does work very well. It does normally contain animal products. If you're concerned about that, there is an alternative. So if you are having your vaccine, do flag that up with your GP or the practice nurse, and they will make sure that they get the vaccine that doesn't contain any animal products. It's readily available, so that's hopefully reassuring. If you move forward, please. So measles is, if I just talk through some of the symptoms of measles, and it's probably because we have got such high rates generally of measles vaccination, then it isn't something we see very readily. So so we're not used to seeing it. So we're not used to, and even doctors won't have seen a lot of measles, so they may not be quite sure whether it's measles or not. There is a test that we can do, obviously. So it's just worth understanding what it might look like. And it normally starts off with just feeling like a cold-like symptoms, particularly runny nose and watery eyes. And then you may get the rash a few days later. There's also some small spots you get in your mouth, and we've got some pictures in the following slides. They can be hard to see, and you don't always see them. So if you do see them, that may indicate measles, but other than that, it can be hard to see. So it's normally the cold-like symptoms, runny nose, watery eyes, then the usual measles type of rash. We'll show you some pictures in the next slides. Because measles spreads so readily from person to person, then if you do have symptoms or somebody in your house has symptoms, then what we don't want you to really do is turn up to your GP unannounced, because it may put other people at risk. So if you've got any concerns that this is possibly measles, then do phone your GP or 111 first, and they will give you advice about how to present to healthcare. So that's the main issue on that slide. Just to say, though, there are plenty of other things that do create rashes. So if you do have a rash, children have childhood rashes quite often. Not every case will be measles. So just get advice from your GP or 111 over the phone in the first instance. Okay, so that call ahead message is really important. Next slide, please. So this shows some of the symptoms that I've just talked about. You can see on the top right, those are the spots. They're called Koplik spots. They can be hard to see. The rash, as you can see on on the bottom right. It it looks generally brown or red on white skin, but it can be hard to see on brown or black skin. So, and there's more information on the NHS website if you are concerned. You can see some more detail on there. Okay, next slide, please. So we've got a range of ways to get other information. I mentioned the NHS website. There's links at the bottom of this. So the nhs.uk, search for measles or MMR, that will give you the information you've got there. On gov.uk, there is a leaflet which is translated into various languages. And at the top, a really useful website, West Yorkshire Healthier Together. It's useful for measles, but it's also useful for lots of other health information. And again, it's available in different languages and can translate that and recite into different languages. So there's lots of different avenues in other languages to help people get information and on measles and the vaccine. Okay, next slide, please. That's questions and answers session. So happy to take any questions on measles or the vaccine, or indeed any other issues that anybody wants to mention. All good?
I've got a question, Steve, if I may.
Of course, Gary.
So kind of thinking on behalf of people who might be talking to people out in the community, what can we say about what we know about how safe the vaccine is and how it works?
Okay, so it works very well, and it works in terms of not just reducing severity symptoms. It's actually very good at stopping you being ill and catching the disease in the first place. It's very well tried and tested. It has been tested. We've been using the measles vaccine in this country since 1968, I believe, and we combined it with the mumps and rubella vaccine in the 90s, and it has always been proven, whichever study has been done, that it is very safe and very effective, and it is something that I highly recommend everybody takes up that offer of that vaccine. It does on a global level. It has saved countless lives. And it is a very effective and safe vaccine. Does that answer your question, Kerry?
Yeah, I think so. Are there any side effects from the vaccine that we know about people should be aware of?
Well, like most vaccines, it stimulates your response in your body, so it can help fight the virus if it does. If you do get measles, so you can have a short-term little reaction to the vaccine, but it's it's not anything untoward and not worrying. So it's not a vaccine that prompts a big reaction.
Steve, if
So
I
no-
could just interject, sorry, it's Lorraine, one of the infection
Oh,
control
yeah.
nurses.
Great,
So you can sometimes get a little bit of a rash, which is what Steve was relating to when he said about sometimes you can get the measles kind effect. So you can sometimes get a rash, which is normally 7 to 10 days post-vaccination, and that's self-limiting, and it will resolve itself, and there is no treatment for that that we need to do. And the other thing is that as with any vaccination, we can sometimes get a little bit of a temperature, and you can sometimes get a little bit of a sore arm because we're giving it into a muscle. But those two things are self-limiting, and we can treat those with a cold compress for your forehead, paracetamol and or ibuprofen. Thanks, Steve.
No, that's great. Thanks, Lorraine. That's really helpful.
So another question is what to do if you know somebody or somebody in your community or your workplace or at school gets infected with measles. Do you need to do anything?
So I'm getting a bit of feedback there, but so if you are aware that you've been in contact with somebody with measles, again, it's probably helpful to understand whether you're susceptible at all. So if you are fully vaccinated, then that's very reassuring. That will be protective in 99% of cases. So you'll be able to go about your daily business. If you've been in contact with a confirmed case, somebody who's had a test result or a doctor said that they think this is measles, and you are not vaccinated, or you've no previous history of having measles, then you'll probably need to think about isolating yourself, particularly if you work with vulnerable people. Then the guidance on that is from 5 days from after you've been exposed to 21 days. So that gives time to be sure that you've not contracted measles, and therefore it stops you passing it on to anyone else.
Thanks, Steve. That's really helpful. So adults can get a catch-up dose as well as children, can they, if they want to?
Everybody can get the vaccination free of charge on the NHS, whether you've had no doses or one dose, or if you're unclear whether you've had any doses at all, then there's no problem in contacting your GP. They'll be able to check, and if for some reason you don't have a record of your status, then there is no problem in restarting the vaccine program and having both doses.
Right. So you just asked your GP.
I have a question. So I'm not sure if I understand properly. So if someone will catch it, so people have to stay up to 21 days if they didn't have before vaccination, or if they didn't have the illness before, yeah?
Yeah, so if you are at risk of the disease because you're not vaccinated and
Yeah.
you've been in contact with somebody who's a confirmed case,
Yeah.
then yeah.
Yep. What about the people which are not sure, because I'm sure that the people in age like 40, 50 years old, they don't really remember if they had the vaccine, when they were really small, a few years old or not. And also some number of people will not remember if they had this illness or not in childhood.
Yeah, absolutely. There's that grey area there that you're not quite sure, and certainly, and you're right on that kind of age range. Anybody much older than that was probably being exposed to the virus as a child, and they'll more than likely be protected. But that kind of age range you're talking, that 40 to 50-year-olds, they may not be clear whether they're susceptible. It's difficult to give advice on every individual scenario. So if you are in that boat, you find yourself unsure whether you're protected and you've been in contact with somebody, then you can get advice. Again, you'll be able to get advice from your healthcare professionals. They'll be able to help give a specific advice to your circumstances.
Yeah.
Steve, sorry, Mike.
Yeah,
Could I also add to that, if you do a certain job, so if you're a nurse or a doctor, or you work in sort of a health and social care type environments, it's recommended that those individuals would have 2 doses of MMR. So if you're sort of got a certain profession, you will be eligible to have your free MMR vaccine as well. So if you're also unsure and you work in certain professions, you can visit your GP and have your MMR as part of that campaign.
Yeah, and I have also some I'm not really sure how it will be working with my experience, like in Polish community, because like if some people are working for recruitment agencies, if they will have to stay in home for 21 days, no one will pay them. Or if probably the employer will also not happy, to let people stay for 21 days in home. So probably people with illness, even if they never had the vaccination, or if they never catch up with this illness, so probably they will go to work, and they will not look. Some people even will not go to the GP, if they will recognize it, that it might be this. So probably they will say anything. Maybe they will put some long sleeve or something like that. Don't show others, but still will go to work.
Yeah, and it's, you'll remember through COVID there was a legislation to say you must stay at home and isolate. This is a different set of circumstances. The isolation is something that we would like people to do if they get into that situation, and that is a rare situation, but that but there's no law that can be enforced there. But particularly, as Emma said, if you work with vulnerable people, then your employer may not want you to be going into work if you are ill. But that's how outbreaks tend to happen. But don't forget, measles can be it can be relatively mild for some people, but it can make you feel quite poorly as well. You may not want to be. If you start with symptoms, then you'll probably not be at work any case. But there is a period where you're not feeling unwell, but you're already infectious, and that's the that's that's the point of the isolation, to make sure that you're not infectious before you know that you've got measles.
And I suppose it's worth mentioning that actually there's a lot of people in Wakefield that have had their vaccination. There's only small numbers that haven't. And as Steve said, once you're already vaccinated, the vaccine does offer you really good protection. So the number of people that will find themselves possibly needing to isolate in this scenario will be a lot smaller, and it won't be anything like we saw for COVID, which obviously causes a great lot of anxiety. We don't expect to see that scale of a number of individuals needing to isolate. We always expect it, bearing in mind we've got good coverage rate overall in the district, to be small numbers of people. So that it sort of, that low numbers means that the level of people that need to isolate are likely to be small if it does happen. And when we know about measles cases in outbreaks and there's adults and children involved who may be unvaccinated, there potentially is sort of opportunity to vaccinate those individuals as part of that response. But I think that's why we're trying to call everyone forward now that hasn't had their vaccination or is unsure about the vaccination to come forward and have their vaccination now, in advance of needing to isolate, as we've just described. So that is the tangible sort of actions that people can take to prevent and alleviate some of that concern that you've described in needing to isolate, and the implications that that has on your pay and your lifestyle and your family movement.
Yeah, and that's the key message, really, that this is preventable by vaccine, and that if you get vaccinated, then even if you are in contact with a known case, then you won't be asked to isolate. So it is really helpful in that sense. So that's the key message here, is try and prevent something from happening in the first place. And we've all had our experience of illnesses changed because of the pandemic, but and we used to having outbreaks that we all remember big COVID outbreaks that take out entire schools or entire businesses. This is very much a different scale of things. It can still be serious for individuals, but it is a much smaller situation.
Yeah.
COVID.
Yep, I have also one question more, because anyway, I had a technical issue and I was unable to join this meeting from the beginning. Probably someone mentioned it. How fast this is moving from one person to another? Is it the same as a COVID, or?
Well, there's two answers to that. If nobody was protected, if nobody was vaccinated, and this was an entirely new disease, then it does move very fast. So if you've got a totally unvaccinated population, one case would pass it on to approximately 15 people if you didn't take any isolation advice. So that does move very fast. But because the vast majority of people are already protected, then it has to find connections to the people who are not. So it moves at a slower rate overall. So measles is one of the most infectious respiratory viruses that we know. So it is really, really infectious in that sense. But because it's vaccine preventable, then it normally, under normal circumstances, it finds it hard to move. But because we've seen a slight reduction in the amount of people vaccinated, that's why we're starting to see a higher risk of cases being seen. But the reassuring message is we have seen outbreaks in London and the West Midlands, but at the minute the numbers locally are really reassuring.
Okay, thank you.
Steve, Is it worth mentioning that we're also seeing outbreaks in Europe and other countries, so that if individuals might be saying, oh, I'm not going to maybe acquire the infection in the UK, but you can acquire it when you travel abroad or maybe visit countries abroad and friends and family, where their immunisation rates are much lower than the UK as well. So they have a higher number of people in other countries that are more susceptible. So maybe when you go on holiday abroad, you might actually acquire measles whilst you're there and come back to the UK and then start displaying signs and symptoms in that way. So it's not only the UK that have measles cases. Measles cases are occurring in other countries across Europe and more broadly than that as well.
Yeah, absolutely. This is the picture we've seen and described here in this country is being replicated across Europe at the minute. Yeah, and there are some countries that have historically had lower coverage rates of vaccinations. Romania, in particular, has lower rates of vaccination coverage.
Yeah, and I'm not sure on 100%, but I'm expecting that, for example, people from the Eastern Europe in age maybe like 60 plus or 65 plus, and very probably they didn't get the vaccination, and because anyway, if someone lived on the village, you know, in the like 1950 or 1960. So probably they didn't get the vaccination, and I'm not sure how they will look now on the vaccination after the COVID, you know, because some people said it was too much, you know, and so people was negative. I'm not sure how they will look, and also I'm sure that maybe small number of people will be too worried, as it was during the pandemic. Some of them can hear it, and then they can stay in home, you know, not move anywhere or something like that. So I think it will be good also to put something like that is like a not big, like it's a no, not extremely risk, you know, or something like that. Because during the COVID, we had a situation, some people were staying home, didn't let children go to school or something like that, or leave the garden or.
Yeah, and I certainly understand those concerns. We have had situations. We've had sporadic outbreaks of measles in the past. So across the country, back in I think 2017, there was a similar situation to what we've had now, but that was before the pandemic. So people may not have been as aware of what was going on. So so there isn't any reason to be overly worried. It's worth knowing your vaccination status. It's worth knowing the symptoms and what to do if you've got a case and you think you might have measles. But other than that, go about your daily business and be reassured. And for people who may have been exposed, who are maybe from another country or older residents, then there is a very good chance that they've been either vaccinated or they've had measles as a child, and therefore they've got lifelong immunity. That can be tested by a blood test, but we wouldn't be doing that unless there's a real good reason to do that.
Okay.
And it's worth also noting, just final comment there, is that measles has been around for an awful long time, which is why we've got a good vaccine. It's been around for a number of years, 20, 50 plus years. COVID was very new. We didn't know, there was so much uncertainty. We didn't understand the severity of illness. We didn't understand how it was transmitted. We know all that with measles. So with that knowledge comes sort of the ability to not be as worried about, the uncertainty as we've seen and as you've described there. So as well, bearing in mind, helping people not to be fearful of the measles and the condition and having a vaccine preventable versus the fear that was created by the uncertainty in COVID.
Yeah.
Yeah. I also know that I'm not sure in about every country, but for example, in Poland, like before vaccination for measles, then it was the measles had very like really big impact on the population, and it was really huge the problem. So I expecting that some people might know about this and might think, you know, how it will be and what's going on, you know, something like that.
Yeah, but because we've got most of the vast majority of the population, you know, over coverage is really high, really. So even if there was an outbreak, it wouldn't be the kind of impact that they may have experienced in the past. So so again, I think it's quite a reassuring message. The other issue around measles is as Emma said, it's been around for a long time. I mean, it's been around for 10,000 plus years with humans, so it's very stable. So it's not like COVID in that we're always looking out for a new variant. Measles doesn't change, so we know that the vaccine works very well and will always give you that lifelong immunity. So a very different kind of situation to what we've been dealing with over the last few years.
Okay, thank you.
I think that brings us nicely to a close, and very much thank you very much for your questions today. They've been greatly appreciated, and I hope you've found the session really valuable. If you want to give us any feedback about the session, please do feel free to get in touch, and we can take that on board for any future sessions. Thank you. All the best.
Thank you.
Thank you.
Thank you. Bye.
Thanks, everybody. Thanks for coming.